Hello, everybody, and welcome to the Tuesday edition of Video Clips. Lots of good stuff to share with you. But first of all, I'll tell you about some free stuff and paid stuff. Most of it's free stuff, actually. Non-member preview. This is an opportunity to tour our libraries and websites and videos, and also to engage in a short Q&A with me, similar to the ones that you would engage in if you were a member. And I have scheduled two of them, May 3rd at 7, May 13th at noon. May 13th is a Saturday. Some healthcare professional free workshops. May 4th, reinventing yourself in independent practice. May 10th, a sample class, the types of things that we would teach you if you were enrolled in our programs, but you'll leave with plenty of information from this program. All right, and those are free. Building your tribe, how to survive these uncertain times. And I do think that survival is important and thriving is important. So May 2nd at noon, May 13th at 1 o'clock. That's a Saturday. And then we have upcoming boot camps that I think you might be interested in. Research on May 2nd, research so that for those of you who would like to know how to read the medical literature the way that I do and discern right from wrong, inform consumers, as you're going to see from today's message, really important. A vaccine boot camp on May 8th and a cancer boot camp on May 15th. Everything from the origin of cancer to how to prevent it to things you should pay attention to if you are in need of treatment. And then our monthly dinner, May 17th, where I give a health talk and do Q&A. I can't feed you virtually. If you're here in town, in Columbus, Central Ohio, come be with us. If not, can't feed you virtually, but you can participate in listening to the lecture and participating in the Q&A. All right, some good reasons to hang out with people like those of us at Wellness Forum and take my research boot camp, etc. I will provide right now. So there is a growing consensus about the mistreatment and overtreatment of lower back pain. And it's really important to pay attention to this because it's a leading cause of disability. And most of the solutions offered by doctors and medical institutions don't work, which is one of the reasons why there's so much disability resulting from back pain. So one of the biggest problems is that abnormalities identified by imaging are notoriously inaccurate for identifying the cause of pain, not just for low back pain, but for other musculoskeletal issues as well. For example, studies of images and pain show that people who say they're in pain often have no abnormalities, while people who have no pain often have structural abnormalities. Only 20 to 25% of people who have back pain have a herniated disc. 60% of adults who don't have any back pain have degenerative changes in their spine. So the bottom line is that imaging is the norm to identify the cause of pain, and imaging is unreliable. The discovery of abnormalities generally leads to surgery to repair them. And the obvious problem is that the abnormalities are not the actual cause of pain, then the patient can't possibly get better as the result of the procedures. In fact, the opposite often happens. And I can speak to this from personal experience. My mother loved doctors, and anything they told her to do, she did. She had an ill-advised back surgery that didn't turn out well, and she had a second one that put her in a wheelchair. And her decline from that point on was horrific, and she died, I believe, 15 to 20 years before she should have, if she had not had all of this bad treatment. One of the issues interfering with reducing the number of orthopedic surgeries is that orthopedic surgeons are some of the highest generators of revenue for medical centers. The average surgeon will generate about $3.3 million per year. So you've got a lot of incentive to encourage this not so great behavior. Surgery is not the only treatment that can make things worse. Prescription drugs will relieve the pain sometimes, but the risks far outweigh the benefits. NSAIDs can cause bleeding. They can increase the risk of cardiovascular events like myocardial infarction. Steroids taken orally have a very long list of side effects, and when injected into the joint, increase the risk of requiring joint replacement later. Opiates are really effective for pain relief, but the obvious problem is they're addictive. And according to the Centers for Disease Control, over 260,000 Americans died between 1999 and 2020 from prescription opioid drugs. I think probably the number is actually higher. There are no drugs that address the real causes of pain, which usually are things like weight, inflammation, misalignment, poor diet, dehydration, lack of exercise. Additionally, research shows that applying cold and reducing inflammation if pain is due to an injury is contraindicated and will also make things worse. Some of you might remember I posted a video about that, wrote an article, posted in our library sometime last year. What drugs and steroid injections will do is cover up the pain for a while the underlying condition, whatever it is, continues to progress. And many people who start out having an acute problem become chronic pain patients as a result of that. So your better options become pretty obvious for this as a result of this that I've told you. Lose weight, change your diet, which will help you lose weight, hydration, exercise, things like yoga, acupuncture, massage, and physical therapy with a good physical therapist. And those are hard to find. We have one in our group, Eileen Kopsaftis. If you remember, you probably have taken her free boot camps and participated in her monthly sessions, which are free to our members. Learning to live better with pain as another option that can't be resolved. In other words, the part of the problem is the thought that everybody should be able to be pain-free. But there are ways that you can learn to live with pain. And in fact, that's what we're studying this week in this book, A Liberated Mind by Stephen Hayes. It's not all about pain. It's all about changing your life and changing your ideas about things. I thought it was a fascinating read. But he talks about the fact that whether it's pain or ringing in the ears or whatever, that people can be taught to live with these conditions, which is a better alternative than many of the things that are done which make things worse, which is what I've been talking about here. Now, here's what's really interesting about all this. All the ideas that I'm talking about here are endorsed by conventional institutions like the Veterans Health Administration and the American College of Physicians. The biggest reasons why the ineffective stuff continues is that these things are profitable. Docs don't know much about creative and more natural approaches to things, solving underlying problems, and patients want immediate relief and really don't think through, and nobody helps them think through the consequences. Which brings me to another point that I think is important to make. We cannot reform healthcare if consumers are not better informed. That's our primary business, by the way. But you have to change the demand end of this, and the supply end will have to change. In other words, if consumers stop saying no to orthopedic surgery, there will be less of it going on, obviously, regardless of whether the institutions that house these people ever change their mind about anything. So I mentioned May 17th, we have our monthly dinner. I give a health talk and a Q&A, and you're welcome to join us remote, as I mentioned earlier. And also think about joining Wellness Forum. I mean, all of this stuff that I'm telling you, we have articles in our library, there are videos online, there are monthly sessions with our physical therapist, all included in even our basic membership, lectures on this book, A Liberated Mind, and also on another book, John Sarno's book, Healing Back Pain, is a marvelous book that addresses this. And he died a few years ago. And at the time, I remember there were so many celebrities who were like Larry King came out and said, I was headed toward disability due to back pain until I met John Sarno, and he took care of it and got me over all that in a very, very short period of time. All those kinds of resources are available to members. And we do have a very inexpensive intro membership. So you might want to join us. Back to some of the things I announced. We do these free sessions to let people see what this is really all about and how you can become an informed consumer. And do take my research boot camp. I'll emphasize that. Anybody can learn how to do better in terms of discerning good from bad in healthcare. I can teach you how to do it in an evening. All right, that's it for today. As usual, I'll pass this on to anybody who you think would enjoy watching it, and I will be back to you tomorrow with more news.